It's been 24 years since my husband looked at me and said, I know why I've been feeling the way that I've been feeling. I have a tumor in my brain. Those words were the beginning of a new beginning. And it was because I quickly realized that the medical system was not about helping us. That was our responsibility. So I used the technology that we had available at the time to help us make life and death decisions about treatments. That was a fax machine. So it was so important that our neurosurgeon shine the light for us to make a decision. And the decision was quality of life versus quantity of life. Now, behind every healthcare technology breakthrough, there is a human story. A patient's waiting for answers, a clinician's racing against time, a family's hoping for better care, or maybe they're hoping for the right care. So today we're going to talk about how the convergence of fire and AI, it's not just reshaping technology, it's really helping to reshape the human experience in healthcare. Hi, I'm Teresa Yunkin. I'm a healthcare informaticist. You'll find me here each week talking about healthcare, AI, fire, anything that's going to make the patient journey better. We know that we've got challenges because for decades, healthcare has struggled with one fundamental challenge. All the data lives in silos. Just like 24 years ago, today it's still the same that the average hospital has dozens of different systems that don't communicate with each other or outside systems effectively. And because we keep introducing new technology into these workflows, the average clinician is now spending half of their day on documentation. Let's talk about the patients. They're still carrying paper records between specialists. And in addition to carrying those records, they're going into portals to find their records. They're making phone calls to find their records. They're still moving the majority of this medical information. That sort of fragmentation, we know and we understand. We don't like to talk about it, but it doesn't just waste time and money. What it does is that it can cost lives because we've got delays in care coordination. We're missing warning signs because the data's so scattered. We're trying to make treatment decisions with incomplete information. That's the reality of modern healthcare. This is not just all doom and gloom by any means, because there are people out there that said, hey, what if we could change that story? And they're working on it. So we have innovations like FIRE. It creates standardized pathways for different systems to communicate. But the true revolution that's being born is when we marry that connectivity with artificial intelligence. Most of the AI that we use today, it thrives on patterns in data. And so when we connect a healthcare system using FIRE, we're not just moving information or data back and forth. Once that gets into your system, it starts to create this digital landscape where AI can start to identify patterns that are invisible to our human eyes. But it can alert us that there's a pattern there so that when we look at it as a human, we can act on it. It's things like when you start to have subtle changes across vital signs that can indicate decline in your patient to alert you. It's looking at population level insights. It's looking at treatment response patterns. I'm talking about individualized medicine like pharmacogenomics. The potential isn't technological. It is profoundly, profoundly human. So in the real world, I think about my parents and they've got multiple conditions and they're seeing a number of different specialists. A lot of times, every time we go see a specialist, they only have one piece of that healthcare puzzle. The more that we connect with FIRE and that we use AI, we can start to get all of the information that can help us to generate insights that are based on the conditions that they have, the medications that they're taking. Think about the pharmacist when you bring them to the table. They're the ones that know when they see the medications. That's when you get truly coordinated care for the first time. And these aren't futuristic scenarios by any means. This is happening in little pilots and projects across healthcare right now. And I'll tell you that the healthcare systems that are going to win this game are going to be the ones who understand this powerful combination. What's a responsible path forward? Well, for one, this journey requires more than just technical excellence. We build these systems and we have to ensure that we're advancing health equity and that we're not perpetuating disparities. We have to design AI that's going to augment human judgment rather than replace it. And lastly, and this is so important, is that we have to maintain a sacred trust between our healthcare providers and our patients. I remember how meaningful it was that the neurosurgeon and the whole team came and celebrated my daughter's fifth birthday while my husband was in the hospital. I still remember how vibrant that cake was and how much better it tasted because right before we had cut into that cake, my husband was able to wiggle his toes. Developing technologies means that we're going to need diverse teams. This is very different than it used to be. We just don't need technical experts. We need clinicians, patients, ethicists, advocates. We need to have that rigorous validation across different populations because what works for one population may not work for a different population. And it means that we need to always maintain human oversight over these systems because the goal isn't to have AI driven healthcare. It's to have human-centered healthcare that's enhanced by technology. Where do we go from here? So whether you're a developer, a clinician, a healthcare leader, a patient advocate, we all have a role in this transformation. From where we stand, of course, the limitations are apparent, but we need to shift our perspective to where AI can augment the lives of patients. It's happening in multi-stakeholder initiatives like Da Vinci's Fire, where we define how data flows seamlessly where it's needed most. But we need those end users to help us pull the threads where there are human connections. So at the heart of healthcare, we're being strengthened, not replaced by technology. The future of healthcare, it's not about a faster system or a better, smarter algorithm. It's about human experiences. And that future, if we allow it, it is within reach. It's here. All right. I'll catch you guys here again next week on the flip side, where I'm going to be talking more healthcare and AI.